In this video, find out the 2 critical nutrients for great health, the type of diseases they support, what dose to take for successful treatment, and links to 22 scientific articles for more information. Heart disease is the #1 killer in the United States, and the evidence supporting vitamin E's efficacy in preventing and reversing heart disease is overwhelming. 2 landmark studies published in the New England Journal of Medicine followed a total of 125,000 men and women healthcare professionals for a total of 839,000 person study years. It was found that those who supplement with at least 100 IU of vitamin E daily reduced their risk of heart disease by 59 to 66%. The studies were adjusted for lifestyle differences, smoking, physical activity, dietary fiber intake, and aspirin use, in order to determine the heart effect of vitamin E supplementation alone. Because a diet high in foods containing vitamin E, as compared to the average diet, further showed only a slight heart protective effect, the authors emphasized the necessity of vitamin E supplementation. Researchers at Cambridge University in England reported that patients who had been diagnosed with coronary arteriosclerosis could lower their risk of having a heart attack by 77% by supplementing with 400 to 800 IU per day of the natural, D-alpha tocopherol form of vitamin E. Pioneer vitamin E researchers and clinicians, Drs. Wilfred and Evan Shute, treated some 30,000 patients over several decades and found that people in average health received maximum benefit from 800 IU of the D-alpha tocopherol form of vitamin E. Vitamin E has been proven effective in the prevention and treatment of many heart conditions. The complete or nearly complete prevention of angina attacks is the usual and expected result of treatment with alpha tocopherol, according to Wilfred Shute, MD, a cardiologist. Shute prescribed up to 1,600 IU of vitamin E daily and successfully treated patients for acute coronary thrombosis, acute rheumatic fever, chronic rheumatic heart disease, hypertensive heart disease, diabetes mellitus, acute and chronic nephritis, and even burns, plastic surgery, and mesoplasia. The reason one nutrient can cure so many different illnesses is because a deficiency of one nutrient can cause so many different illnesses. Vitamin E is a powerful antioxidant in the body's lipid, or fat, phase. It can prevent LDL lipid peroxidation caused by free radical reactions. Its ability to protect cell membranes from oxidation is of crucial importance in preventing and reversing many degenerative diseases. In addition, vitamin E inhibits blood clotting, or platelet aggregation and adhesion, and prevents plaque enlargement and rupture. Finally, it has anti-inflammatory properties which may also prove to be very important in the prevention of heart disease. Among other things, vitamin E supplementation reduces the oxygen requirement of tissues, gradually melts fresh clots, and prevents embolism, improves collateral circulation, prevents scar contraction as wounds heal, decreases the insulin requirement in about 1/4 of diabetics, stimulates muscle power, preserves capillary walls, reduces C-reactive protein and other markers of inflammation. Epidemiological evidence also suggests that a daily supplement of vitamin E can reduce the risk of developing prostate cancer and Alzheimer's disease. If all Americans daily supplemented with a good multivitamin multimineral, plus extra vitamins C and E, it could save thousands of lives a month. Millions die each year from heart disease and stroke, and the overwhelming evidence is that vitamin C supplementation would save many lives. 2-time Nobel Prize winner Dr. Linus Pauling estimated that the rate of heart disease would be reduced by 80% if adults in the U.S. supplemented with 2,000 to 3,000 milligrams of vitamin C each day. According to Dr. Pauling, since vitamin C deficiency is the common cause of human heart disease, vitamin C supplementation is the universal treatment for this disease. For those with existing heart disease, Dr. Pauling said that blockage of heart arteries could actually be reversed by supplementing with 6,000 milligrams of vitamin C and 6,000 milligrams of lysine, a common amino acid, taken in divided doses throughout the day. Vitamin C supplementation both lowers serum cholesterol levels and repairs lesions of arterial walls. 1998 Nobel Prize winner Dr. Louis J. Ignarro found that supplementing with vitamin C and vitamin E significantly reduces the risk of developing arteriosclerosis. A study examined vitamin E and vitamin C supplement use in relation to mortality risk in 11,178 persons aged 67 to 105 who participated in the established populations for epidemiologic studies of the elderly over a 9-year period. Simultaneous use of vitamins E and C was associated with a lower risk of total mortality and coronary mortality after adjusting for alcohol use, smoking history, aspirin use, and medical conditions. A landmark study following 85,000 nurses over a 16-year period for a total of 1.24 million person-years found that vitamin C supplementation significantly reduced the risk of heart disease. Intake of vitamin C from foods alone was insufficient to significantly affect the rate of heart disease. High quantities of vitamin C from supplements was essential to provide the protective effects. The study adjusted for age, smoking, and a variety of other coronary risk factors. An international team pooled data from 9 prospective studies of 293,000 people that included information on intakes of vitamin E, carotenoids, and vitamin C with a 10-year follow-up to check for major incident coronary heart disease events in people without disease when the study began. Dietary intake of antioxidant vitamins was only weakly related to a reduced coronary heart disease risk. However, subjects who took as little as 700 mg of vitamin C daily in supplement form reduced their risk of heart disease events by 25% compared to those who took no supplements. Researchers in Finland measured serum vitamin C levels in 2,419 middle-aged male participants of the ongoing Kuopio ischemic heart disease risk factor study. Men with a history of stroke were excluded from this analysis. Participants were followed for up to 10 years. The outcome of interest was development of stroke. During the follow-up period, 120 participants suffered a stroke. After controlling for potential confounders including age, BMI, smoking, blood pressure, and serum cholesterol, the researchers found that men with a low vitamin C level in their blood were more than twice as likely as those with a higher vitamin C blood level to experience a stroke. A stroke commonly occurs when a blood clot or thrombus blocks the blood flow to parts of the brain. A thrombus may form in an artery affected by arteriosclerosis. A recent study has shown how low plasma vitamin C was associated with increased risk of stroke, especially among hypertensive and overweight men. Vitamin C preserves the integrity of the artery walls and strengthens cardiovascular tissue. Research indicates a reduced incidence of major coronary heart disease events at high supplemental vitamin C intakes. Recent studies have shown that vitamin C appears to reduce levels of C-reactive protein, a marker of inflammation, and there is a growing body of evidence that chronic inflammation is linked to an increased risk of heart disease. Most Americans fail to eat the USRDA for several vitamins and minerals. Supplements are not the problem, they are the solution. Malnutrition is the problem. Subscribe and like below and check out our next video.